while I was there, I looked after a 14-year-old girl, her name's Shahada, and she had a brain tumor, and she was listed for evacuation in October 2025. She was on the critical evacuation WHO list, which means there was a hospital ready to receive her. She had a diagnosis. There was finances to provide everything for her to leave Gaza and have her procedure done. Now, I met her in the beginning of January, and during that time, she had not been evacuated. The tumor had grown significantly, that she'd become blind in one eye and was losing the sight in her other eye. The equipment that was recommended for this procedure was not available in Gaza. But if we did not do something to intervene with this brain tumor, she would start to have very severe symptoms such as seizures and would eventually die a very painful death. So there was a big discussion with the family and the patient. You know, you're going to die without this operation. You may die if we do this operation. You're definitely going to become blind. And this is a 14-year-old girl. And this 14-year-old girl is in a room with her mother, her father, and her siblings all in the one room and always present, and everyone always part of the discussion. And, you know, here we have to say that we think you should have this operation because this is in your best interest, because if we do it, you have a chance. If we don't, the future is looking very bleak, painful, and actually horrific for you and your family who will watch this happen. So then ensued a long discussion between the clinicians, local clinicians, myself, and another international clinician, about how are we going to do this so that we cause the least harm possible and that we can get the best outcome for this patient. And so you have to offer this option to the girl, who was very, very intelligent, understood everything, and the family. You know, we also had to think, you know, if we do this, and this is an operation that's very risky, we're going to occupy an intensive care bed probably for 7 to 10 days. Can we even justify doing the operation because of that? So these are the considerations we're taking in this particular case. We did the operation with the family's agreement, the young girl's agreement. She was in intensive care for 7 days. She unfortunately died. So that's a case in action, if you like, of how we have to use the medical ethical principles. And then how we think about moral injury, because the moral injury has a number of directions for us. Should we have done it? Should we not have done it? Many of the situations that we witness in Gaza should not happen.
Yeah.
And it is very easy for them not to happen. And that's lifting the blockade, ending the occupation, making reparations, opening crossings for medical evacuations. And we're still in that situation now.